Would you look at that? The New York Times is catching up to how sick the president actually is. I'm a physical therapist with a doctorate in my field and 14 years' experience treating geriatric patients in home health care, just like the President of the United States. The New York Times article acknowledges he's keeping a shorter public schedule than he used to. Most of his public appearances fall between noon and 5 p.m. on average. The reason he's not doing any public appearances after 5 is because he sundowns after 5 p.m. This is a typical symptom of Alzheimer's or dementia, where as the evening comes on, a dementia patient becomes more confused, more combative, more difficult to deal with. They don't want you to see any of that on camera. And of course, Grandpappy turns to Natalie Harp, his executive assistant slash 24/7 dementia caregiver, to type up another social media post where he calls the reporter from the New York Times ugly. Awesome. Then he says, there will be a day when I run low on energy. But with a perfect physical exam and a comprehensive cognitive test that was aced, it certainly is not now. Listen here, you piece of shit. You have dementia, and your ego is so big that you would never admit that, even if you could remember that you have it. You have a history of lying to the American people about your health for over a decade. And all the sycophantic pieces of shit doctors that you've had hired over the years are complicit in this lie. On top of having dementia and probably also a history of stroke, congestive heart failure, and chronic kidney disease, I'd say the president has 3 to 5 months left in the land of the living. Thank you for your attention to this matter, you embarrassing sack of shit.